طلبتنا الأعزاء، المرحلة الخامسة راح نقدم شرح مختصر brief description about preventive dentistry اللي هو يتضمن المحاضرة الأولى. The general aim of any worker in the health service is the health of the individual. Health, what we want to preserve. Health is what we want to preserve. It is a state of complete physical, mental, and social well-being, and not only the absence of disease. This involves general health as well as the oral health. إذن هذا definition of the health لازم أنتو تخلي ببالك، وإحنا الإفورد عند السيرفيسز اللي راح نقدمها من خلال الكوميونيتي راح تكون أفضل وتكون أوسع مما أنه تقدم من خلال الإنديفيدوال. ولهذا ال preventive dentistry, this term has a different meaning to different people, as a public health dentistry, community dentistry, and social dentistry may be used in the change with the term preventive dentistry, while comprehensive dentistry may involve all these services under the title of comprehensive dentistry. ولكن احنا نشوف انه نلقى انه هذا المصطلح بمسميات وبمصطلحات مختلفة. The general definition of a preventive dentistry is the employment of all measures that can be attained and maintain a maximum oral health, also to equal to the lifespan of the teeth to lifespan of the man through primary, secondary, and tertiary prevention. Maximum health surfaces of the oral cavity اللي هو area of our interest. A preventive dentistry involves 3 different levels. The first one, primary prevention. What is the primary prevention? It starts in the pre-pathogenic period of the disease, before the disease itself starts. Before, under 2 lines, before the disease itself starts. إذن هي كل services or technically ممكن أنه نجريها before the disease itself starts. It includes the employment of the technique and the agents, material to prevent or to reserve the progress of the initial stages of the diseases and to arrest disease process before treatment become necessary. إذن احنا كل الإجراءات مثلا نستخدم الفيشر سيلنت before the caries occur in the tooth have fissure and bed deep fissure or bed. Also modification, education, fluoridation in the school, water supply fluoridated. All these considered under title of a primary prevention. إذن primary prevention, it include number 1, the health promotion, a health education in oral hygiene. Number 2, good standard of nutrition. Good standard of the nutrition during school and during her or his life. Diet planning, periodic screening or inspection, all these terms under title of primary prevention. Number 2, specific protection, good oral hygiene, fluoridation of public water supply, topical fluoride application, avoidance of sticky foods, particularly between meals, toothbrushing after eating, dental prophylaxis, and a preventive orthodontic. Therefore, all these health promotion and specific protection under the title of primary prevention, while secondary prevention employ routine treatment method to terminate a disease process and to restore tissue to as near normal as possible. Example, amalgam filling, root canal treatment, crown pulp capping, etc. All these technique, all the procedure which are done when the disease are take place and present. Therefore, we must do root filling, cavity preparation, and another type of a treatment like pulp therapy, direct pulp capping, indirect pulp capping, pulpectomy, epixification, etc. While the tertiary prevention employs measures necessary to replace loss of tissue, loss of teeth maybe, and to rehabilitate patient to the point that function is as near as possible after failure of secondary prevention, like relapse of the lost teeth to prevent destruction related to the teeth loss, like TMJ problem. After secondary prevention, failure of root canal, failure of treatment of fractured teeth, etc. This lead to the loss of the function. We must rehabilitate this part which are lost, like tooth or teeth or tissue. This considered as a tertiary prevention. Prevention is a philosophy of practice based on the perspective that focus on the maintaining health rather than on the treating a disease. As a mean of providing guidance for clinical practice and correlate it with the philosophy of preventive dentistry, a procedure sequence is suggested. These sequences are considered the basis for treatment planning. Are 5 phases. We have 5 phases must be suggested. The phase 1, urgent care, while phase 2, gingival and periodontal therapy. Phase 3, prophylaxis and anticaries therapy. Phase 4, occlusal adjustment. Phase 5, counseling itself care. Urgent care is the treatment of emergency condition like relief of an existing condition as extraction endodontic. Phase 2, gingival and periodontal therapy, is an attempt to control soft tissue diseases. While phase 3, prophylaxis and anticaries therapy, periodic dental prophylaxis, fluoride therapy and fissure sealant. هاي الفيسز ما ممكن نتجاوزها، لازم ناخذ هاي الفيسز بالتتابع أو بالتسلسل. Phase 4, occlusal adjustment by surgery, restorative procedure and construction of prostheses. Phase 5, counseling itself care, involve complete education program in oral health, started from the first visit and continue throughout the entire period of the patient care, even in the recare period. Now, oral disease. The oral disease in general, dental disease can be grouped into 4 categories. These are dental caries, periodontal disease, acquired oral condition, and hereditary disorder. The most prevalent oral diseases are the dental caries and periodontal disease. dental caries and periodontal. These are known as a plaque-related disease, اللي هي diseases of our interest. These are infectious disease caused by bacteria of a dental plaque. Strategies to prevent, arrest, or reverse the plaque diseases based on: number one, how you can minimize these diseases, dental caries and periodontal. Number one, by reducing number of challenge oral pathogen. Number two, building up the defense of the teeth. Number three, enhancing repair process. يعني نذكر مثال reducing number of challenge of the oral راح نسويها بعدة إجراءات، بعدة تكنيك، بعدة خطوات. building up the defense of the teeth من خلال البريودنشن، من خلال إجراءات أيضا متعددة. enhancing and repair process وهكذا. These 3 points can be achieved by. إذن concluded this 3 point اللي هي تعتبر important in order to minimize this dental caries and periodontal disease can achieve by: number one, mechanical and chemical plaque control. Mechanical plaque control by using toothbrush and interdental cleaning devices as a toothpicks, dental floss, interdental brush, while chemical plaque control is through the uses of chemoprophylaxis agent as a toothpaste and mouth rinse. For example, الكلوروهكسيدين. الكلوروهكسيدين يعتبر the most important and famous as one as a mouth rinse. رقم 2, uses of fluoridated product, either systemic or topical fluoride agent. نستخدم الفلوريد systemic fluoride أو التوبيكال fluoride من خلال dentifrices أو من خلال الووتر سبلاي أو من خلال الدايت إلى آخر. رقم 3, diet and sweet restriction by controlling the frequency and consistency of sugar intake. نقلل السكريات، نقلل الأكل ما بين الميلز. رقم 4, number 4, uses of Fisher sealant, and this will be mechanically prevent accumulation bacteria on the tooth surface. Number 5, health education by patient education and motivation. Well-planned program as a school-based program. Number 4, public education program. Thank you very much, my student, due to your listening to the second lectures, and this is the first lectures will be followed by another